As of Tuesday, 3 new cases of measles were reported in Giyani, that's in Limpopo, bringing the number of cases in Limpopo to 15. According to the World Health Organization, the district meets the requirements for the declaration of an outbreak. Now, Limpopo Health MEC, Dr. Phophi Ramathuba, joining us now to give us an update on the situation. MEC, good morning to you and thank you very much for your time. Let's deal with the numbers first. How many people are infected with this measles outbreak in the entire Limpopo province?
Morning, Oli, and morning to all your viewers out there. If we look at the cumulative numbers from the beginning of the year, when we started with the entire close monitoring and surveillance, we are sitting at 20. At 23 from the 2 yesterday that came from Ramathuba municipality. And they range from the age of 6 months to 24 years. Now, when you look at the highest, the district that has been hard hit, it's Kukune, which is at 15. But also yesterday, we received another case from Fitahomu, Tuvazi, giving Kukune to 16. And then remember district, we are still at the 2 that we were detected early in the year. And of course, Mupani now has increased their numbers to, I think, 7, if I'm not mistaken. So yes, indeed, Mupani district, if you look at since the current outbreak, which we look at September up to now, they now have got 4 cases, 2 in Phalaborwa and 2 in Giyani, making them to be declared an outbreak, because when we deal with the outbreak, the definition in terms of measles, it's to say if you can have 2 or more cases within a population catch-up of 100,000 in a space of a month, then that is an outbreak.
Yeah. All right. So in which districts then, MEC, has an outbreak been declared?
Sekhukhune and Mupani now. We have now declared Mupani the 2nd district. Remember, we've been dealing with the Sekhukhune for the month of September and October. But since yesterday, we have now declared Sekhukhune also, because they've got 2 cases in Phalaborwa. They also have got 2 cases in Giyani. That has happened within the month of October. And you can see that the catch-up population within those sub-districts does meet the requirement of to be declared an outbreak.
Your quick advice, MEC, to parents of these children. I mean, you've mentioned that the youngest is 6 months old among those who are infected, all the way up to 24 years. What is the advice to parents out there, or perhaps what kind of symptoms are to look out for, and when do you go to a medical facility?
I think maybe one should start at your last question of the symptoms, to say if from the onset of contact, because this is a virus that you would be infected because you've been in contact with someone who has been infected with measles virus. So from that onset, which can take up to 5 to 7 days, when you start to see your child having fever, accompanied 3 days later of that fever, which is accompanied by flu-like symptoms, you then start to see a rash from the body, starting from the lower upwards, which is some generalized. The maculopapular rash, which has got red spots, you should be suspicious. And if you've got those 2 accompanied with either the 3 C's, I think the way they used to teach us, 3 C's, which includes your cough, your conjunctivitis, this is the eyes being red and the child scratching the eyes, and coryza, which include the running of nose. So if you have those one of the three, two, then you should be worried as a parent to say that child require urgent attention. Why are we saying that? Because if you don't do that, the measles, why we give it so much attention is because if not attended to, you can complicate, and we've seen children who died out of pneumonia because of the complication, encephalitis. We have seen the ear infection complicating to loss of hearing, eyesight challenges. So we need to really be vigilant. Now, that is why now the advice we are saying is that measles, it's something that we have declared as a country that come 2030, we should have eradicated measles in South Africa. But why did we say it's because we knew that the vaccine can be able to do that and assist us if we are to achieve a herd immunity. But the challenge that we are facing, having studied all these cases, whether they are South Africans, whether they are coming from outside, which we've such cases, all of them, what is common amongst them is that we can't prove, there's no evidence that at some stage in their life they did receive a vaccine or they've been immunized as children. So that is why we're saying we have dropped the ball. Some of our officials are saying because of COVID-19 pandemic, when everybody was focusing on COVID-19 and all resources were directed towards that. Some parents were afraid to take children for the clinics. We had challenge at some stage for a national challenge in terms of supply of the vaccines. But when I look at some of these cases, they've long passed the 12 months. Because now the guideline says at 6 months you must vaccinate, and also at 12 months you should vaccinate. So hence the campaign that we started at Sekhukhune, where we had hit to vaccinate every child who is below the age of 15 years and is above 6 months. We are doing that to say even those that have been vaccinated but our contact don't have symptoms, we are giving them the booster so that we are able to cap the spread. So my advice to parents is that please take your child for immunization. Check that route to healthcare chart. If at 6 months, at 12 months, your child was not vaccinated, did not receive measles vaccine, visit your nearest clinic. It doesn't matter where are you, as long these are a communicable disease, these are infectious disease. For instance, the 2 cases were picked up in Phalaborwa. They've got a history of having been to Sekhukhune, meaning they could have got the virus when they were traveling. We're in a global community. Yeah. We've seen in some of the other countries where there is currently an outbreak. So we really need to say we're moving towards festive seasons. Children from Gauteng will be coming back to their provinces, their home province. They will be going back to their other countries or any part of the world. So it is important to make sure that before you travel, visit your nearest clinic, get your child vaccinated and travel. When you come back in January also, we're going to check if you have been vaccinated. We'll be going to schools, working with basic education, social development, looking at all our ECDs, if all the children have been vaccinated.
Yeah, MEC, briefly on this one, I'm out of time. It's no secret that this measles outbreak is a cause for concern in Zimbabwe, and some 700 children have died as a result. How many cases are you handling coming from Zimbabwe? We know how you have complained in the past about the kind of strain that the health system in Limpopo is facing at the moment. So how many of those cases are being handled here in South Africa stemming from Zimbabwe?
I think when we're dealing with the communicable disease, infectious disease, we usually wouldn't even want to look where are you coming from, because the important thing is that when you are in a country, you have been in contact with children in the country, you need to be vaccinated. That's why even the Constitution is very clear our Health Act is very clear. So we are not going to start discussing who is undocumented, who is not. Of course, we do have, but the fact of the matter here is that we need to work with our counterparts, like we've done with cholera, like we did with malaria, to say it doesn't matter. As long as it's affecting any other neighboring country, it will definitely affect us, especially that we do have parents who are still not taking their children for immunization, who are not taking their children for vaccination. So it is quite important to say we separate things. When dealing with communicable disease, we have to really work differently to make sure that everybody gets that vaccine. So we are dealing with cases, and we will describe them in terms of their age and probably their gender and where they are currently geographically located for the sake of tracing. Yes, we will ask probably your origin so that we can further advise authorities where you're coming from. For instance, when we have a child who's saying, I'm from Tembisa and test positive, we would want to inform our counterparts in Gauteng that can they contact trace some of these cases to do that. But it is a concern, especially now that we are moving towards festive seasons. There will be movement, especially amongst the school children. Hence, we have already started this campaign to say every single child who is currently in the country, irrespective of how they come to the country, they've got to get the vaccine.
MEC of Health in Limpopo, thank you very much for your time. You've heard her. 2 districts have declared an outbreak as a result of this measles outbreak. Sekhukhune and Mopani districts. Very, very important messaging from the MEC there.